Okay, Jordan. I just want to thank you for coming here to help me with my school interviewing project today. The whole point of this is for me to be able to see, along with my professor, my strengths with interviewing, along with my weaknesses. I'm going to be working with patients a lot, trying to gain medical history, things like that. So this is pretty important for me moving forward in my field. And just to let you know, there's 100% confidentiality here. My professor is going to be looking at it just to help critique what I have going on. But besides us and her, no one else will be seeing this. So feel free to say whatever comes along. Now, you mentioned to me that your condition is diagnosed as chronic pancreatitis. I just was wondering if you could explain what that is to me in general.
Your pancreas has two ducts where the food and enzymes go through the digestive system.
Mhm.
And when I was born, mine are really small. So like when my pancreas is normal, like everything goes smoothly, but sometimes it gets inflamed, causing the ducts to like completely disappear and nothing can get through, and we have to wait it out until it, the swelling goes down and everything goes back to normal.
Okay. And then, so you said that this is something that comes from birth, so it's been with you your whole life.
Well, yeah, but I never like knew I had it until the first episode.
Okay, so it's not something that like they can check for right away or anything like that. Okay, so before we go any further with the pancreatitis, I'm just gonna ask you a couple questions about your lifestyle, diet, things like that. So, would you say you eat 3 times a day, a variety of food groups?
Yeah.
Okay, that's good. Do you sleep normal now? Like, have you ever had any issues sleeping?
Yeah.
Huh, that's good. Do you have a family history of any pancreatic disorders?
They think that my aunt may have had it just because what I go through with it, it seemed like back when she was a kid, she went through the same thing, but they never got it checked out. She thought it was just your average like stomach ache, and
Yeah.
so we never have a confirmation of it. But
Okay. So that'd be interesting. Maybe go back in time, see if anyone further up the family tree had an issue. I could relate to that. So, do you think you could just talk to me about some of the signs and symptoms you experience with this condition?
when I like start from when it started first time.
Yeah, just take me through sort of what happens like through
Okay.
your head as it goes on.
Every time I wake up at like super early, like earlier than I would normally wake up, so like 4 or 5 in the morning, with really bad pain in my stomach. Feels like a rope is tightened around your stomach and someone's like pulling it really tight. Um, I can't eat or else I'll like throw it up. If I can't keep down water, then I'll have to go to the hospital so I can get an IV for fluids. Um, it really hurts to get up and walk around. I'm like doubled over. So the only reason I would get up out of bed is to use the bathroom. I'm in bed for a good 3 days. Not first day I don't eat anything. Second day I'll try like some soups with low sodium or some type of like non-solid foods, and then like as the pain goes down I can try like more solid foods, and I'm usually always on my back. I like being on my side or like on my stomach really hurts.
So basically, synopsis of that is your whole life completely changes for that amount of time. You can't really eat at all. I can see where not being able to really swallow or drink anything can cause a problem because being dehydrated isn't going to really help heal your body heal anything. It'll probably impair it even more if you think about it in that way. So that makes sense. So I just wanted to ask you a little bit about your condition specifically. So do you remember when this first happened? You said it never really got diagnosed at birth because it wasn't an issue then. So
First happened when I was 10 going on 11. Summer before 6th grade, we were on vacation and I woke up really early with a stomach ache. So like did your basic like go to the bathroom,
yeah,
eat something, like try to fix it, and nothing helped. And I waited until around a little after dinner time,
Mhm.
and I asked my mom if we could like go to the hospital. So we went, and they thought it was appendicitis, but when they like did all the scans, that looked normal. So then we had to go home to Connecticut, and we went to the hospital for about a week when they did their tests, and that's when they found out what it was.
Yeah, because it's not really a common
No, usually
disease.
it happens in alcoholics when they drink too much. That's what
Yeah.
they get. But yeah, pediatric pancreatitis isn't a common occurrence.
Okay. Now, was there anything abnormal that was going on while you were on vacation? Did you weren't
No
eating anything?
normal, no big deal.
And it just
Wasn't taking any medication.
quick onset. And when was the most recent time this happened?
Last time was my freshman year. I'm a junior now, so I was at 18. Yeah, the winter I turned 18. Was the
Okay.
last time I had it.
So it's something that still is relevant today, for the most part, you'd
Well,
say.
this is the longest I've gone without having an episode.
Okay.
We never went to the doctor just like after that to see if like I grew out of it, if my ducts opened up. I haven't really followed through, just watchful waiting.
Okay. Now you said that this is the longest time period that you've been without a flare-up. How many other times have you had it? What's the usual time frame in between?
I would get it 2 or 3 times a year. I don't know how many times I had it. I had an ERCP done, and then after that, it was a good year until I got it again. So the procedure didn't seem to help
Yeah.
at all.
So what do you mean by ERCP?
Well, they put a camera down my throat and took pictures of it, and then they went in again and cut a slit in my ducts and put a stent in there, a temporary one.
Okay.
And so that like opened it up more, and then like after a couple weeks it fell out on its own, and I passed it and had no idea like that it came out.
Oh well.
Yeah.
But those aren't supposed to come out.
No, that was
Oh,
temporary.
they are supposed to
Yeah.
be temporary. Okay. Interesting. Okay, so I mean, you've been talking a lot about how it's severe pain, how it really impairs your ability to even get out of bed or do anything. If it's happening twice or 3 times a year, it's a pretty debilitating disease, I would say. On a scale of 0 being the almost no pain to 10 being the worst pain you felt, which seems like you're describing as some degree to me. When is it the worst? Is it when you have this condition? Is it always one, or is it worse throughout a day? Or
So like the first day is pretty bad. Say like a 7. And as it progresses, like the stomach pain obviously will go away after a couple of days, but I seem to get like headaches from not eating, and after the first day or so I'll get like a back pain in my lower back.
Mhm.
But once I'm able to like get up and start eating, the head and the back pain go away.
Okay. So and this usually comes first day. You're waking up early, everything like that, like you were saying before. It seems. Do you have any idea? Does the back pain feel like the rope in your stomach that you were mentioning before? That's a cause from your pancreas being inflamed, or
No, 'cause I don't have it
okay?
as soon as
And
it comes a little later.
were you ever prescribed medication for the disease in general, or all the pain of
My
it?
ducks, I don't even know what kind of medication. I only took it for 2 weeks because the side effects were pretty bad, so that was the only time.
Okay, and you don't really
I
take
take
that.
Tylenol for my head.
Okay, you get pretty bad headaches.
Yeah, from like not eating.
Okay. Now, have you ever thought that like your back may be stiff due to not being able to really get out of bed at all?
So,
Uh, do you really do anything? Are you in bed 24/7 for the most part?
yeah.
You don't just bathroom breaks,
Yeah.
food's being brought to you.
Yeah.
You're on your back, your side.
Not my side, just my head.
Okay. Huh.
With sometimes I put my knees out and that
Mhm.
seems to help some pain.
And usually at this point, you're not really checking in with the doctor because you've already been there for the flare up, and they just send you home.
After the first couple episodes, we realized that there's nothing that the hospital does that's helpful unless like I can't keep my fluids down, then we need the IV. But if I'm drinking water like fine and nothing's coming back up, then we would just stay home and wait it out.
So it's as time goes on, it'll get better, but
It's just
throughout the
something.
first couple days, it bothers you. Now, after your uh, stomach loosens, your inflammation goes down. Does your back linger a little bit with this pain and your headaches? Do they stay around for a little bit?
Well, when I'm like up and like trying to go back to like the normal way, like eating and like walking around a little bit, then the head and the back pain tend to go away.
Okay. Now, what it sounds like to me is that your doctor basically has under control, or your family rather, on how to handle your pancreatic issues. And it's great that it hasn't really come back in the past year and a half. Hopefully, it stays away moving forward. But I think from a physical therapy perspective, uh, the pain that you experience in your lower back is related to you not really being able to move at all. Just being on your back 24/7, being basically stiff and bedridden, it can result in weakening of your muscles, them gaining fatigue if you're always putting pressure on them. So, what I would say, I mean, your prognosis seems pretty good. After 4 days, it seems as though you collect yourself back together and you're fine moving forward. But just in case it does happen again, I think our best option would be to put together some sort of mobility exercise along with stretching in bed so that even though you might not be able to get up, you can still move around, get your blood flowing, make sure your back is getting worked just so it doesn't fatigue and make your whole situation that much worse, you know?
Yeah.
Excellent. So, I just want to thank you again for helping me with this. Hopefully, I didn't intimidate you too much or was too fidgety or anything, but do you have any other questions? Awesome.